In other news tonight, today the Kansas Senate voted down Medicaid expansion. The Kansas House did the same thing back in March. This likely ends any discussion of expanding Medicaid in the state this year. And KSHB 41's Charlie Keegan joining us live from the newsroom. And Charlie, walk us through what Medicaid expansion would have meant.
Cameron, Medicaid is health insurance from the federal government. It's mostly for people with low incomes. And each state can expand Medicaid. That makes more people eligible for this health care coverage. Supporters say 152,000 Kansans would have been eligible under the proposal that was working its way through Topeka. Today, I spoke with Stephanie Barr, whose mother would have been one of those 152,000 Kansans, but her mother was not eligible for Medicaid when she died of cancer in 2021. Stephanie herself actually beat cancer 14 years ago because she qualified for Medicaid back then.
Taking the burden of thinking about the cost of treatment off of me was what enabled me to put on those fighter pants and say, okay, I don't have to worry about, how am I going to be able to afford to, to pay for any of my treatments.
I want to point out today's vote wasn't just right down party lines. Some Republicans sided with Democrats to vote for this idea, and supporters of Medicaid expansion say that gives them some optimism for a new proposal next year.
There's been an awful lot of work that's happened this year. Just regular Kansans reaching out to their elected officials to tell them this is very important to them. And I think that it was really gratifying for them to be able to see that there was that they were being listened to.
Laura Kelly has pushed for Medicaid expansion ever since becoming governor. Today, she said she'll continue to, quote, fight to build a healthier and more prosperous Kansas. Charlie Keegan, KSHB 41 News.